Around 670,000 people worldwide are diagnosed with heart failure each year. And although it affects people of all ages, it is the leading cause of death for those aged over 65. I spoke with Dr. Nooshin Bazargani, a consultant cardiologist at Dubai Hospital and the chair of cardiovascular disease prevention of Emirates Cardiac Society, about their important new campaign that's designed to save lives.
Campaign name is Your Heart Cannot Wait, and it is organized by Emirates Cardiac Society. It aims at increasing the awareness of heart failure in the entire population of UAE. So it contains TV interviews like that and media campaign, including as well some heart failure awareness days in the key hospitals in UAE.
So it's certainly an important message to get out there. But tell me, what is the difference between heart failure and heart attack? What are some of the things we should be aware of?
If you want to define heart failure by itself, is simply the weakness of the pump function of the heart, so inability of the heart to pump enough blood and oxygen to the entire body. And it has a lot of causes, heart failure itself. If a person has these risk factors, it may push him to have a cardiac event like heart attack. So patient will come as heart attack to our hospital. If the patient does not get the appropriate treatment on time or does not come for appropriate management and follow up in hospital, his heart may start getting bigger, larger, and the function of the heart as a pump may diminish. So it will push him into heart failure. So in another word, you can say that heart failure is the final destination of patients who have cardiovascular risk factors and they are not maintaining it, controlling it, and also for patients who already have cardiac events like heart attacks. Heart failure is very common. It has been estimated that about 26 million people live with heart failure globally, and out of that is about 3.7 to 3.8 in Middle East. It also has been estimated that every person has a chance of having heart attack in one stage of his or her life, in 1 in 5. So heart attack is very common disease.
Okay, so let's talk about the prevalence here in the UAE, because there are concerns that many patients are showing signs of heart disease around a decade earlier compared to other parts of the world. Why is that?
Well, the reason for that, there are definitely some genetic element for that cause, but also lifestyle and overpopulation in our region. The prevalence of diabetes and hypertension is higher for younger generation in compared to the global population.
So what are some of the early symptoms that we should be aware of?
Common symptom of the heart failure is difficulty in breathing. So typically patient comes to my clinic and would say that when I walk, I get difficulty in breathing, or even when I lie down at night, I have to get up because I have difficulty in breathing. Patient may feel very much fatigue and lack of energy when they get up in the morning. Some people may have swelling of their ankle and their limbs. Some other people, they just come with a very unspecific chest pain and sometimes even palpitation. They feel that their heart runs very fast. So these are the symptoms that patient usually feel, and the key point here is if you are having risk factor for cardiovascular disease, especially for patients who have risk factor for cardiovascular disease, you should seek medical advice very early, because that will enable us to do certain tests and diagnostic investigation to find out whether you have heart failure or not. And if you have heart failure in cardiology is one of the most promising branch of cardiology, because the pharmaceutical agents and the interventions that have been discovered in the management of heart failure can actually change the pathway of the disease. We actually can save lives and can save more quality of life for our heart failure patients because of the advance in the pharmaceutical therapy of heart failure.